Vitamin D, a micronutrient that nearly 80% of Indian population is deficient, plays a vital role in vital body functions. Not having sufficient levels of vitamin D can make your bones weaker, cause body aches and decrease your ability to fight the infections. In fact, its deficiency has been linked to depression too. But how big a role does this nutrient play in fighting COVID-19? According to Dr. B. Subjit Kumar, a consultant surgeon at the Apollo Health City, he states that there is an indirect link between vitamin D levels and COVID-19. In many studies, it has been found that persons who succumbed to the infection had low levels of vitamin D. So having a good level of this micronutrient in the body is necessary at this time when people are mostly working from home and staying indoors. We are not exposing ourselves to sunlight, which is the primary source of this vitamin. Even before the pandemic, more than 80% of the population in India have been found deficient of vitamin D, which plays an important role in fighting several infections. So now the question comes, how can this vitamin help in fighting the COVID-19? Vitamin D is an immunomodulator, therefore it helps in reducing the cytokine crisis. It also upgrades the ACE2 receptors, the ones the COVID-19 virus downgrades. So this is how the vitamin D can help in reducing the lung inflammations. So vitamin D is essential in treatment of COVID-19, but we cannot say that taking the vitamin can bring down the mortality rate. For the COVID-19 treatment, vitamin D is as important as vitamin C or antivirals or steroids. Irrespective of COVID-19, human beings should maintain the requisite levels of vitamin D, that is 2000 units per day. It helps us in fighting any infection that our body might suffer from. Several health experts have stated that vitamin D is important to fight all infections and just not COVID-19. Most Indians are deficient of this micronutrient either due to our skin tone or rapid urbanization. Vitamin D is made with the help of UVB rays of sunlight. In a city environment, pollution does not allow most of the rays to reach human beings. For a fair-skinned person, half an hour exposure to the sunlight is enough to manufacture the requisite amount. On the contrary, too much exposure can destabilize the vitamin D already formed. And for dark-skinned persons, 45 minutes exposure to the sunlight is enough to build the requisite amount of the vitamin D.